Hello, everyone, and welcome to MBBA Learns webinar, Thrive ESQ, Black Lawyers and Mental Health. Um, my name is Paula Edgar. I'm the president of the Metropolitan Black Bar Association. You can see me right there. Please do connect with me. I am more than willing and open to hearing from our members and our supporters. Just so I can check on the audio, if you can hear me, can you raise your hand using the dashboard on the webinar, please? Wonderful, wonderful, wonderful. Okay, great. So let's go. I'm going to give you a little bit of an overview of the organization, and then we'll start talking about the content. The conversation we'll be having hopefully will be robust. You will be able to utilize the dashboard to type in any questions you have, and I will read them out to the panelists. So the theme for this year for the Metropolitan Black Bar Association has been impact, and that is innovation, mentoring, partnership, advocacy, community, and training. And I'm happy that this is at least 4 of the 6 on the screen, this webinar. So if you're not a member, we do encourage you to join or to renew your membership, because we do need your feedback, we need your advocacy, we need your participation in order to make the organization what you want it to be. Our next program that we'll be having in person is our inaugural transaction boot camp. And this is something that has been asked for many years, where we have done annually a boot camp that's focused on litigators. This one is focused on the folks who are interested in transactions and how they work, or who are in transaction and want to up their skill set. We're excited because you'll be able to get 6.5 CLE credits all day, followed by a reception. We give you breakfast, we give you lunch for a very small fee. So if you haven't registered, please do register today and share this with your friends. Similarly, we have the following weekend our Brooklyn I'm a Solution, which is called Your Vote is Your Voice. We will be talking about advocacy, being more engaged civically, the need for us to vote and to really become knowledgeable and engage in our civic space, not just for ourselves, but for our communities. And we are pairing that off with a community law day where we'll be providing free legal services, advice for the community. So if you have not yet registered for that, we do still need volunteers to serve as subject matter experts, and we also want people to attend and join in the conversation with us on that day. Another fun event we have on Monday the 18th is our annual spades and golf and spades tournament. So if you're like me, just like golfing but don't know how to do it, and you want to come and swim or do tennis or play spades, it's a really fun day of fellowship for good cause. All of the funds for this event go towards our scholarship fund. And so we encourage you to register. We've got a DJ. It's a really fun event, great networking, and it's a good time to have some downtime with other folks who are similarly minded. And then our next Black-owned bar series. So we are doing an initiative where we support Black-owned bars within the city in order to provide, and help out businesses. And so that will be on June 20th in Brooklyn. So we have a lot of stuff going on in Brooklyn this month. And then our my final membership meeting as the president, and our annual membership meeting where we do our elections, will be held on Tuesday, June 26th at Goodwin Proctor. I will be offering a free CLE, as some of you know that I do professional development trainings, and so I'll be doing a free 1-credit CLE in the diversity and elimination of bias credit area. So that'll be fun, and I look forward to seeing you at one or all of those events. So now we are going to start the conversation. I'm going to introduce each of our panelists and then ask them to provide some background on their bios. And I'll start with you, Carl. So Carl Forbes Jr. Esquire is the founder of Forbes Jr. Law Firm, PLLC. He is also a board member of the Metropolitan Black Bar Association. Carl, would you give us a little bit of detail about your background?
Sure. Good afternoon, Paul and everyone. Thank you for having me. So, as Paula mentioned, I'm an attorney and the founder of my own law firm, which is a general service firm in New York, focusing on civil litigation, real estate, small business work, and trust and estate. Prior to launching my own firm, I worked at an international corporate firm where I focused on commercial litigation, and also have spent time working for the New York City Law Department Office of Corporation Counsel, where I defended the city in personal injury, property damage matters. I am born and raised in Brooklyn and continue to live in Brooklyn and practice out of Brooklyn, and love all things Brooklyn. So I look forward to our conversation today. Thanks.
Wonderful. And then we have our next panelist is Ifeoma Ike, who's the founding partner of Think Rubik's. And for clarification, letting you know that she's also one of my classmates, or within my class realm, not my classmate at CUNY Law School. So I'm happy that we were able to collaborate on this. Ify?
Hi. Are you able to hear me, Paula?
Yes, we are.
Awesome. Well, thank you, Paula, for inviting me. Carl, it's great to be joined with you. And thank you, everyone that's on this call. As Paula mentioned, I am a CUNY Law alum, also an alum of GWU Law School, with my LLM in Advanced Dispute Resolution and Litigation. My formal legal background, I have had a little stint in the big law world, but for the most part, my background has been mostly in policy, serving within the city of New York with Department of Buildings, as well as on some criminal justice and social justice advocacy spaces. Also serving as a mediator for the courts of New York City, but also within Congress, and most recently serving in the as a senior employee and advisor to the mayor's office. While there, I was working right before I left the mayor's office. I was working on designing some of the mental health efforts as it relates to African Americans within the city and throughout the nation, which I'm really happy that the Metropolitan Black Bar Association is a formal partner of our efforts there. So really happy to be here and hopefully here as a resource and a source to folks on the phone. In my day-to-day capacity, I'm a principal and founding partner of Think Rubik's, and we mostly try to solve problems, with the law being one of them, but also trying to make sure that we design solutions so that people and our people can live better and equitable lives. So again, thank you, Paula.
You're welcome. So the format for our conversation today will be exactly that. We're just going to have a conversation. I have some prompt questions that will show up on the screen. For those of you who are listening, if you have questions at any point, you can use the question area on the dashboard in order to type out your question. And then, like I mentioned, I'll pose it to the panelists. So, our first slide, says change the stigma. I think that many of you will agree that there, in the African American community, there tends to be, or has tended to be, a stigma associated with needing and asking for mental health services. And so, one of the initiatives that we're going to be talking about, well, if you will be talking about later, is Thrive, and particularly Brothers and Sisters Thrive, and she'll get it more into that. But we're delving into this space because for lawyers, on top of the stresses that we have generally, we also have the stigma of being, we're supposed to be the folks who have the solution, and when the people who have the solution have to tap into resources themselves, there tends to be a lot of frustration and maybe even embarrassment on a myriad of other things that may go into how folks feel. So we want to change that stigma because we believe we can be our better selves when we tap into resources the same way that we suggest that our clients tap into us. So I thought I'd start off by getting your feedback here. So and I just realized it was supposed to like pop in the answer, but it did not. So I'll just go ahead and read it to you. So there's a 2016 study of 13,000 lawyers that was conducted by the ABA, said that between 20.6 and 36.4% could be of attorneys could be considered problem drinkers. Also, that 28% of those surveyed suffered from depression and 19% had anxiety. So I just wanted to get your thoughts and feedback about that, and I'll provide a little bit of perspective on some things I've recently experienced as well. Iffy, what do you think?
So I think the statistic is in many ways not surprising, and I think it would alarm quite a few people that the statistics, especially among professionals of color, is way higher, right? It on average takes about 10 years if somebody does decide to be diagnosed. Within the African American community, it takes us about 10 years before we even seek some type of help or treatment. So, and that's just for those that determine that something is wrong, right? So we're talking about 10 years from the point where you know something is wrong, but you don't get a formal diagnosis for about 10 years. We also know that there's a higher percentage of African Americans, and I would also say that that's broad. So if we include the Black community, which would also include, Black immigrants and other immigrants of color, because of the stigma from both a cultural standpoint and even the history that we have with the medical community here in the United States, we underreport because of the knowledge that medicine and practitioners have not necessarily been in our favor. B, because we do have some real serious intersectionality with other spaces, including the criminal justice system. And C, the reality is there really is not a well-built out framework that allows for us to have economic security by stating, hey, I have a problem, right? Or, hey, something is wrong. So it is still a scary area to say, yes, I have a substance abuse or substance misuse concern, because on the opposite side, while you may, get help or treatment, there's no guarantee that your employer, in the midst of all the other biases that you may face in your profession, that they're going to understand that you are going through an unhealthy period. So I actually think these numbers are actually really low. That even at times when we have an anonymous survey, we're still so afraid to admit that there is something wrong for fear of retaliation and repercussions.
Paul, what do you think?
That last point, if you made, is what strikes me the most. Is I think the numbers are much lower than I would have expected or hoped to see. And the reality is often we don't want to admit when we're going through something that could be considered to be a mental illness. And so we say, well, nothing's wrong, or we try to push through it. And so, for instance, the points on depression and anxiety, having a conversation recently about the reality, especially in the African American, Caribbean American community, that oftentimes it's looked at as laziness. So you don't want to get out of bed and go to work because of the pressures that you're facing, when in reality it might be depression. It may be a situation where the constant pressures for perfection and meeting unrealistic goals, or even realistic ones, but the amount of pressure we put on ourselves can ultimately manifest itself into depression. But we've been raised that you always have to be on and you always have to be able to perform, and you can't let people see your weaknesses. So it's looked at as, well, you're being lazy, or you're letting, as the church community, the spirit of laziness overtake you, when in reality it may be something more serious going on.
I think that even more intersectionality piece that you mentioned in terms of the immigrant aspect is something that, while I know it because I have it, I didn't think about how that played into this, because there are a lot of folks in our Black legal community who are from other countries and whose families do have that added sort of pressure in terms of that perspective. So Yeah. Uh, that
Yeah,
was a little
I'll
sobering
just
for me. I thought about
I,
that.
I
Yeah.
I mean, I'll add to it from a personal note. So my family's Jamaican. I left out in my bio. I went to Binghamton University and Columbia Law School, and I mention that now because I was always pushed, especially by my mother, to always strive for the best and to try to attain perfection. And part of it, I think, with immigrants is our parents and grandparents emigrated here and left their home to make a better life. And so they don't want to accept anything less from their children because otherwise they could have just stayed in their
Mhm.
place of birth or their homeland. And oftentimes, 100% attendance, for instance, was always the goal. And so even if I was physically sick, I needed to go to school unless I literally couldn't move. And so to
Mhm.
say that something's going on mentally, which you can't outrightly see, that didn't fly. It wasn't, I just don't feel good today, or I'm something's going on. It's you can walk, you're going to school, and so I think that plays a lot into now as um, lawyers and professionals that continued. Now our parents may have moved a bit away from that, but it's ingrained in us that quest for perfection and always being on.
Yeah. um. So the
And if and Paula,
sure.
just to, I know you want to move on, but I
No.
and we can talk about it more on other slides. Is that to add an extra layer to that? Is that being black, um, and being whether you're here or whether you're first generation, such as myself, whether you're raised in another country, but also being woman, right?
Mhm.
Adds another layer.
Mhm.
Being a black woman, and if you are going through and I would actually say for black men, it's a similar. We cope similarly, but the repercussions are a little different. And oftentimes, especially in the legal profession, not wanting to be seen as a quote unquote emotional black woman,
Mhm.
um, or having to keep up the persona of being the quote unquote strong black woman doesn't necessarily serve us on a day to day basis. Now, it may be exactly what our bosses want to see,
Mhm.
but oftentimes, similar to what Carl was saying, that when you're not getting out of bed, and that is seen as, even if it's an internal critique of yourself, as, oh, I got to
Right.
get out because I'm useless or I'm lazy. The same is true as to when you're feeling things on your job, right? Whether it's microaggressions or under promotion, or conflict management is very you're being slighted, or your responses to things, you're made to feel like I something like there's a buildup of something here, but I don't want to come across as that woman, right? Um, that has to do with, like, obviously society has a way of genderizing emotion, but aside from that, there are times when what an individual may actually need is a coach at that time, right? And not a coach because something is wrong, but actually it could be an indication of onset or early depression or anxiety or other things that are definitely treatable. And I just wanted to note that, because we do have people that are listening, and I just want to, if the only thing people get from this is, I want people to be encouraged that they're not the only one, right? They're not they're not this is not abnormal. But that in addition to immigration, there are several other intersectionalities, LGBTQI experience, or ability experience, that all contribute to how one is being perceived at the workplace, and also how one handles and tackles, if they perceive that there is a mental illness issue that needs to be addressed.
So I'll share a personal experience of mine that I had. I think probably since I was in law school, been struggling with attention, with being able to focus. And those of you who know me are probably nodding your head, but but it wasn't until I actually went to a meeting where someone came and when they were speaking about lawyers and tapping into resources, where they said that oftentimes attorneys have undiagnosed ADHD, um, that prompted me to think my goodness, might I have undiagnosed ADHD? And that prompted me to go to my doctor, who told me to go to a psychiatrist to have that assessment done. And really, I realized that I had been struggling, doing all of the intersectional pieces that you just talked about. Like, I'm a black woman, I'm an immigrant family, I'm just a go-getter and a doer. I'm just anxious and unable to focus because I'm always doing something. Where in actuality, there was something that was wrong, that I was, sort of squelching because I thought that's what I was supposed to do. To ask for help in that area didn't even cross my mind at all. And I think for all of us who, lawyers tend to be type A's, right? We tend to be the doers that people rely on. And so if you look at the question that's on the screen, and I think we answered it just now, right? This is the reason why is because of all of these things that we have experienced in our perceptions of who we are as Black people, and particularly as professionals who have been achieving, that we often don't do the things that we need to do to take care for ourselves. So I just screen. So hold on. Okay, so here, so that way, I think if you started to mention this, like, how can mental health issues impact you at work? I think.
And let me.
Go ahead.
Yeah, let me add to the very quickly to the 20% statistic, which is related to how it impacts you at your job. And Carl kind of talked about this, right? How, like, even with a society that is coming to grips as a whole, that mental health is really a public health, or mental illness is a health issue. There are a couple things that are a little different for the African American community. Number one, we still suffer from a disproportionate percentage and reality as it relates to poverty, right? Which then means that, and to be clear, there may be even some folks on the phone, I don't want to scare nobody, but there are many people that think that they're middle class and they're really not middle class. Which is to say that the added stress of economics disproportionately impacts us, which means that that's an extra length of time, and may even be for your entire time on this earth, may be a hardship. And that hardship doesn't just become your hardship. That usually is a generational hardship, right? This is why we know that in utero, babies come out inheriting the stress of their mother. So when you think about the generational stress that we've all endured, right? All of us being of the diaspora, whether you were born here or not, that's a lot to carry on generationally. You add into that the pressure that many of us have coming from, I'll speak for myself. I'm first generation Nigerian American, grew up in Trenton, New Jersey. My dad drove cabs. My mom works in the same hospital that she's been working at before I was born. This is 30 some years later. So I also have this extra push of, like, I can't afford to fail, right? And that type of pressure in the legal profession, in many ways, I think we value it because we see that as the go-getter. We see that as the typical type A way of being. But there's also something about that means that we are willing to overcompensate or to undermine when we are actually not healthy. Similar to your situation, when I was in law school, I've been legally blind all of my life. I've never declared it as a disability. It wasn't until I was in law school that one of our deans, Paula, had actually said to me, why did you not declare this? Because had you declared this, you actually would have been granted more time for the bar. And even when she said that, I literally, like, everything in my body was like, no, I don't want extra time, because I saw that as some type of, like, a handout, if that makes sense. Or I saw it as like a compromising my ability or questioning my ability, when the reality is half of my class pretty much, whether they had a disability or not. There are other people that knew the game, and I don't want to say that it's all a game, but there were people that definitely declared specifically for that reason. Mm-hmm. So we often have a combination of things that by the time we are in a law firm, or by the time we get other clients that we identify with, right, whether we're public defenders and we understand what it means to have a family member that isn't able to pay for bail, or we're in a real estate transactional space and we want to somehow get to the partner track, we are always having to, the profession, even if you have 100% mental health wellness, if you will, which nobody has. But if you think that you have that, we're already jumping over hurdles, right? The percentages of the number of us that end up being partners is still pretty low, especially amongst women of color. For men, they now have to play in this, like, the boys club, which sometimes comes in conflict with how they themselves were either raised or how they would treat other, people around them in their social circles. So that's just on a good day. Many of our jobs have affinity groups and things that we could reach out to. But again, I do believe that in most professional legal spaces, we are concerned about what if somebody sees me, and what does that mean to them, and what does that mean to my promotion, and what does that mean to my client. And I think that that's something that impacts the entire legal community, but it just hurts us in a very, very, like, a little bit more severe way, if that makes sense.
Well, I will tell you two different things that I have been witness to in the past few months. One seemingly benign, and the other one was quite startling to me, as Carl will probably know what I'm talking about. But the first is this: I tried to suggest an event for the Bar Association where there would not be alcohol served. And I will just say that to outrage and like pushback is probably too low of a word, where it has become so ingrained into our well-being and just being that alcohol is combined with that whether or not we state that as being a problem culturally, we navigate in spaces where alcohol is utilized to foster togetherness. I mean, I just talked about the Black Bar series, which now thinking about it, I maybe should have let that slide out. But anyway, so the point is that because substances are so ingrained in who we are as lawyers because of how we connect, that there's an added thing on that. Even if, like you mentioned, if you don't have you're close to 100%, we still have this other additional piece, right, where we are leaning on and relying on, oftentimes, a lot of alcohol in order to be with each other. Now, I will tell you that I was at an event at a law firm recently where I walked in like one of the private bathrooms, and there were women in that bathroom who were doing what I assume was cocaine, and I'm still shocked by it. Just because I guess I'm not in spaces where that happens often, right? But that it was at a law firm. I mean, anybody probably could have walked in that. I guess in hindsight, they probably should have locked the door, right? But I walked in on that, and it was just as if nothing. They were in this space of, this is what we do. And I was so concerned. This is one of the reasons that prompted this webinar, because it was two Black women, and we have a need. We have to address the fact that there are folks within our spaces that are hurting, and that are leaning on places that they probably should not be in order to make themselves be able to navigate. And so, yeah. So the question on the screen is exactly that. There are so many. I mean, I'm guilty of this. We all are in some space. Like, we have to achieve. We have to get to that next level. There's always going to be somebody who's asking us for more, because when you do good, people want you to do more, right? The question I'm getting asked the most is, okay, when you're finished with the MBBA, because you did such a good job as president there, what else are you going to do, right? Not are you going to go relax, but what are you going to do now? Like, if your plate is partially empty, then you're not doing what you're supposed to do. So thoughts on this?
So one of the thoughts that I have is, it's interesting that the three of us on this panel all are principals of our own businesses, and that strive for existing in a space that's ultimately underrepresented. One as Black attorneys, two as minority business owners, three, adding for Paula and Ife, as women, is the stresses that come along with that. And so I'd like to share my story about kind of battling, or what's brought me into mental health awareness and caring about that. I launched my own practice back in February, had made the commitment to do it about a year ago. Was still working at the big law firm that I was at and recognized that I still needed to do my job at the top level possible, both because that's just naturally who I am. I think most of us are as attorneys and type A personalities, but also because ultimately knowing I was leaving, I couldn't be that person that they could then speak negatively of and attribute whatever negativity to all Black attorneys or all, have it trickle down to the other Black attorneys who were at the firm. And I became fixated on launching my own practice, and what should have been among the happiest time of my life was probably the most depressing. And I realized that thinking through it in that the stress of the job I was working at and feeling out of place, I started not wanting to go to work. And so that's what I was mentioning before about, trying to overcome, well, it's just you're being lazy. When in reality, like I'd wake up and not want to leave the bed and not want to go to work, even though I knew for other reasons in terms of setting myself up for my practice, I needed to go to work. And on top of it, I had a commitment I felt to myself to continue to do the job I was in at the top level. That feeling of pushing myself through to go to work turned into, well, I wish something bad will happen to me, but not too bad, so that I don't have to go to work. So and as a kid, I've broken a ton of bones, so it's something I related to. Oh, breaking my ankle wouldn't be that bad. I'd miss work for a couple of days. And I started to realize, and I talk about it because I realized that speaking about it and connecting with people who go through similar things and hopefully helping someone participating to realize you're not alone is important. And so, Paula, when you mentioned ADHD, I immediately was like, I probably have ADHD also, and I've thought for a long time. But the struggle in bringing it back is, as a Black man, not showing weakness. And then what Ife mentioned about our history with the medical profession. And so I struggle to go to a doctor for a regular physical. And so then to go to a doctor or therapist or counselor for perceived mental issues just seems completely foreign. And so I think ultimately it's that cycle. Go ahead.
No, I think this is deep. I'm mostly keeping my phone on mute because every 2 seconds I'm like, right? Because it hits you in a place where, if we're honest with ourselves, this webinar, and even when we get to resources and how people can get help, all of that is still, if we're honest with ourselves, it's still a very do at your own risk, right? That it's one of those things where we can't guarantee that there's going to be a 100% support and or acceptance of, this part of your life that, when addressed, could actually mean that you could probably have an even more improved quality of life than you ever have had. But we do still live in a society where the stigma is not just made up. We live in a society where the stigma is as a result of a nation that, amongst a whole bunch of biases, we definitely have biases of what we think we know about individuals that live with, mental illness and emotional, disorders and even substance misuse. And so, those things together, coupled with the fact that, and we'll get to this more in depth later if we have time, but I do think it's worth noting that as of right now, only 5% of all mental health professionals are African American. That was a bit, I'm trying not to use the word crazy in light of the topic we're talking about, but that in itself is a disparity that, when you recognize that you can have all the money in the world, you can even have a sound body, but without a sound mind, it means nothing. We have a severe workforce issue. And that's part of the reason why, I'm obviously through personal, familial, a whole bunch of things, social justice issues. We know that, majority of the individuals that are locked up in the mass incarceration system, including juvenile justice system, do suffer from some type of mental illness.
Yep.
So they're dealing with a health issue. And yet, if we're honest with ourselves, mental illness does not get the same attention as, say, the way opioid use is being seen as a health issue right now. So there still are some stigmas and biases within our larger cultural framework that, like Carl mentioned, most individuals, and especially with African American men, are more willing to figure it out on their own, speak to their barber, maybe confide in a family member that won't, quote unquote, out them, right? And think that they're crazy or use it against them if they get in an argument with somebody and they want to use that as a way to get back at you, which means that most people go through it by themselves. It's a silent dilemma. And because in our society, we have learned to say things like, oh, there's nothing wrong with your uncle, he's just touched, right? Or when your grandmother goes out to the porch and she's out there every Sunday for 30 minutes, oh, grandma's just having quiet time. Well, grandma may actually be applying some mindfulness techniques, and uncle may not just be touched. There may be something wrong, but we don't have the language yet to be able to identify and accept it within our culture. So there's a lot of work to be done. There's a workforce issue, there's a language issue, and we who are in the legal profession could probably look to, for those of us that are in the justice space, look to our clients to learn a little bit more about what their experiences are. But some of us don't even have to look that far, than from ourselves or our family members to start recognizing, like, what are the ways that we label mental health or mental illness or mislabeled it, and what are the ways we can, on a daily basis, try to, like, micro-tune that so that we at least have the same knowledge and language, so that if Paula says that, she has ADHD, that doesn't let a partner feel that means that Paula's not going to be able to complete a task, right? That we actually understand what that means. And I think that there's still a risk there because, we don't necessarily control how language and perception, especially of our community, is handled. So it's a scary thing, and I just want to acknowledge for both of you, and for all of it, like, thank you for sharing your story because this is a webinar. This is also being recorded. So it is risky to put that out there.
So
absolutely,
if we don't, we are doing a disservice to the community that we say we want to serve. And while it is a vulnerable space, I think it's much more a place where we can bless rather than stress, right? Like we can help folks by understanding that they're not alone in this. And so, speaking of not alone, we have a question, and the question is: it says the family caregivers are often left out when they are oftentimes the most valuable in the patient's care. The HIPAA tends to be one obstacle. Why do you think the system avoids caregivers in terms of support? And any initial thoughts about that? I have some. But any thoughts about this?
So unless an individual, and I think we all know this, right? Unless an individual is literally declared incapacitated to the point that they cannot make the decisions on their own, I think we all know, like, the laws are very much, especially the health laws, are in many ways designed to allow the individual to have, like, an uncompromised relationship with their personal history. Obviously, the exception, we've seen it in areas ranging from, sexually transmitted diseases to even, at points when the court has had to step in and say whether or not, based either on IQ or illness, whether or not there has to at least be somebody that intervenes. Even as far as children, there's still somewhat of a protection of your health overall. What I do think, and I would love to hear more, and maybe we can follow up from the individual that wrote this question. What I do think, though, that this question is speaking to are a couple things. The main one being, for interest of time, that within especially Black communities, our concept of family is very different than what the world views views family, right? For myself, I'm an African American woman who doesn't have any dependent children, but that doesn't mean that I don't take care of family members, right? So every time it comes tax season, when they're like, "Do you have any dependents?" I'm like, "Well, it depends. It depends on the time. It depends on the time of the day." But that speaks to the fact that we have informal but to be respected ways of how we protect and take care of ourselves, and the law hasn't evolved to allow for caretakers and or individuals that maybe are able to identify that their sibling is, maybe needs a little bit help, or maybe there's an undiagnosed psychosis that only comes in an episodic manner. We don't have, the laws haven't yet evolved to make room for that. And because of all the stigma that we just mentioned, I love caretakers and family members, but the flip side is some family members and caretakers are a little crazy, literally and figuratively. So to know that your life could change from a caretaker and a caretaker's observations, that would open the door to your records being revealed could also be, that's a liability on so many different levels. So I'll stop there. But I do think that there could be some more advocacy about how we identify formal and informal ways of taking care of the village, if you will, and how that could inform how we better take care of ourselves when we want to address and or take care of a loved one. And I don't know if you two have a different way of looking at that.
Carl?
I'd love to hear what I'd love to hear what you have to say, Paula. It sounds like you have something pressing.
I think that if you hit a lot of what I want to say on the head, right, it's that oftentimes those caregivers can be the source of much of the stress that we continue to have. And so that while HIPAA is a constraint in terms of being able to have access to information, another constraint and another obstacle is that because we have culturalized not supporting each other in the right ways or lashing out rather than helping because we haven't had that support ourselves, that I would want to focus advocacy on having the individual be able to tap into those resources on their own first, or at least in conjunction with the advocacy for more caregiver, because I know it's not one or the other, it's both. But I have just personally and experienced and also witnessed as a third party where those caregivers can be harmful to the process. So that's what I have to say about that. Anything else you want to add, Carl?
No.
It's clear. It's becoming very clear to me that we're going to have to do a part 2 of this webinar, because similarly to what happened when we did the motherhood and the law webinar, we got through like 3 slides, and then we were like, oh, and a lot of that was also about mental health as well in that webinar. So what I'm going to do is I'm going to fast forward a few to your slides, because I do want to make sure that we get these covered in both of the sessions that we're going to do. So here we are on the screen, and then we'll take some questions and answers for the last couple of minutes. Okay, go for it.
Sure.
Tell me when to move to the next slide.
So I'm going to go. Sure. I'm going to go very quickly, and these slides will be available to folks, right?
Yep.
So, okay, great. So, if you haven't heard of Thrive NYC, just to be clear, I am not officially a part of the Thrive NYC team, as in the team that is under New York City First Lady Shirley McCray. There is an actual Thrive NYC team, but I mention it because it gives the overview of Brothers, Sisters Thrive in the Mental Health Advisory Group, which my team was responsible for creating. So Thrive NYC applies 6 different principles as to how we address mental health, one of which is changing the culture, one of which is identifying an issue early, followed by closing the treatment gaps, partnering with communities, utilizing data in a more efficient way, and it is a government entity. So it definitely has a theory that government should be doing more to ensure that that the services are available to communities. So with the next slide, I wanted to kind of just share with folks, Paula, I don't know if you
It's there.
got to the next slide. Oh, okay, so I'm a little delayed. Wanted to also highlight that when we were building when we were building Sisters and Brothers Thrive, we started from the stance of basically, as you see from those pins, that Black mental health matters. It is important to call it out and to put all the issues that we have raised, for the statistics that we learned about. I won't go through each of these slides, but we wanted to make sure that we were centered and that our culture, both here and afar, was recognized when we were trying to address the disparities and the gaps within the African American community. We wanted to make sure that the messaging was authentic, and there's many different ways that needs to be authentic, right? Oftentimes with government spaces, when they want to do something for Black people, they go to two spaces: our Black professional and or traditional spaces, like the NAACPs and your Black Lawyers Association, or they go to the church. And we wanted to make sure that if we really wanted to create an equitable strategy, that we had messages that reach our as whole as we can be, our entire family, and making sure that especially those that are really in need of information, that they were to receive it. And so the final piece was that we knew that to do that, we had to have meaningful partners. We wanted to make sure that we had partners that had wide reach and network, but we also wanted to make sure we had partners that knew that it wasn't just about their membership, that it was also about who their members were connected to, which is why it was really crucial when, Paula, it was actually on me. Paula had heard about Brothers and Sisters Thrive very early and was like, I really want MBEA to be a part of it. So moving forward, we've already kind of, on the next slide, we've already kind of talked about many of the statistics impact the African American community. And one of the things that I want people to recognize, especially for those that have young children, is that young people are also impacted by this too. So even though we have here that 1 in 5 adults experience some type of mental illness, if you scroll down to the third bullet point, that Black youth are 47% less likely to visit a mental health professional than white children, despite having similar rates of mental health challenges. This is really, really touching and telling. This is why for myself and many folks I'm sure that are on this webinar, that we can't talk about mental health without talking about how it impacts children. We also have to be diligent to talk about how, where children reside, right? And oftentimes that's in school. So one of the things that, we were talking about before is that, none of us pop out of our mother's bodies as, 28-year-old professional lawyers, right? We have a pathway that often, that would be really painful. We have a pathway that, in many ways conditions us to respond to our mental health, often at a very young age. And one of the things that I'm very concerned about is how many of our young people have been misdiagnosed as being truants or being problemmakers or troublemakers, or even put into special ed, when the reality is there may be a mental health concern. So all of these things were kind of the challenges that we were dealing with when creating a strategy. And moving forward, what ultimately resulted was that the women, people that work at City Hall, worked with under the direction of the First Lady. We created what is now called Sisters Thrive, and its complementary partner, Brothers Thrive. And we're already in the midst of the campaign. Throughout the rest of this year, we will be working on making sure that we train 10,000 by the end of this year, 10,000 individuals in mental health first aid. If you have not heard of it, please make sure that on the last slide that's here, and I'm kind of fast forwarding, Paula, for the interest of time, that you we'll make sure that people can get information about how to train for mental health first aid. think of it as first aid for your well-being, your mind, but also being able to recognize stressors, able to recognize illness in the community around you, as well as how to respond to it. It is an actual certified course. As of right now, New York City is offering it for free, the largest municipality to do so. So we are strongly encouraging, especially the African American community, to sign up for this training, which as of right now, we are disproportionately under-trained in this area. I'm happy to report that since the launch of Sisters Thrive, right before Brothers Thrive, we had about 3,500 plus individuals trained already. So we want to continue towards our 10,000 mark by the end of this calendar year. And over the course of the next 3 years, we believe we can achieve it. Combined with Sisters and Brothers Thrive, we want to make sure that we hit at least 20,000 African Americans. And the slide that I think people are seeing here is these were our initial launch partners, which comprise of the Divine Nine, also known as the National Pan-Hellenic Council, as well as some other affiliate groups like 100 Black Men, Jack and Jill, and the Links. But MBDA is also a formal partner. So if any of you all are members of other organizations that you feel need to be a part of this, please either respond to the questions, please email, and we will make sure that we will get you signed up. I don't know how much more you want me to go about Sisters and Brothers Thrive, Paula, but the most important information I want to get is that last slide, which is if you yourself need more information and or if you need to share information with folks. The great thing about Thrive NYC is that there is a chat, a private anonymous chat messaging service that's provided if you were to go to Thrive NYC or go to even Google NYC Well, you will see that there are 3 different ways you can communicate with a mental health professional. You can chat, you can text, you can also call 1-888-NYC-WELL. So I just wanted to make sure people got that information in the event that they didn't come back to the next webinar. There are they're all confidential, anonymous ways of reaching out to someone. Obviously, if there is an emergency, please dial 911. But we also encourage folks to be a part of the Stigma Free Zone social media campaign. We are going to schedule our darndest with Paula's crazy schedule to get her to do a video, but we encourage anyone to do a video, hashtag it Sisters Thrive, Brothers Thrive, or hashtag Thrive Together. Please let us know what other ways we can support getting trainings to you. If you cannot leave your job to do a training, we can host a training at your workplace, which could also be really great for those of you that are at law firms, and it is not just for African American employees, which for many folks can be very difficult. So we want to make sure that you are positioned as a conduit within your place of employment. And of course, my email is down there for anybody that wants to partner or have any questions about Brothers and Sisters Thrive or the Mental Health Advisory Group, which we just launched. I am happy to provide information.
So I'm sorry that we ran overtime. We had to start a little bit late, but I promise you I will gather these folks again to do a part 2 so we can talk about some of these other issues. And the one question that was in here that we have a couple questions that have not weren't able to get through. We will definitely schedule another time to answer your questions. We appreciate you being on the call today, and stay tuned for round 2 of this webinar. All have a wonderful, wonderful day, and thank you for joining. Bye-bye.
Thank you, everyone.
Bye.